Mansi Gawali, one of the students of medical college. So today I would like to test your eyes.
Okay.
So what is your name?
I am Gawali Madhukar.
Okay. So do you wear glasses?
No.
Okay. Will you please look at this chart?
Yeah.
Now I'll be testing your vision.
Okay.
Now cover your one eye and start reading the letter from the top as far as you can.
E F P T O Z L P E D F E C F D E D F C Z F F E L O F Z D D E.
Okay, that's fine. That's fine. Now cover the other eye and read from the top again.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F F O T E C L E.
Okay, fine. Thank you. Record the visual acuity, which is expressed as two numbers. The first indicate the distance of the patient from the chart, and the second the distance at which a normal eye can read the line of letters. Now I'll test your near vision. So will you please read the first sentence?
Once upon a time, there was a girl called Cinderella. She lived in a grand house with her father and two stepsisters.
Okay. Yeah. Thank you. Now look straight ahead at my nose and tell me as soon as you see my fingers wiggle.
Yes. Yes. Good.
Now cover your one eye and tell me as soon as you see my finger movement.
Yes. 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 Yes.
Okay. Now cover your other eye and again tell me as you see my finger movement.
Yes. 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 Yes.
Okay. Thank you. Now I will move this red top pin inward. Just tell me when the pin first appears to be red.
Yes. 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 Yes.
Now I'll inspect your eyebrows and eyelids.
Inspect the eyebrows and eyelids. Note the position of lids in relation to the eyeballs. Inspect for the width of the palpebral fissures, edema of the lids, color of the lids, lesions, condition and direction of the eyelashes. Inspect the area over the lacrimal gland and lacrimal sac for swelling and look for excessive tearing or dryness. To inspect the sclera and conjunctiva, ask the patient to look up as you press your lower lids with the thumb. Look for any nodule or swelling and inspect for color. Note the vascular pattern. Assess your extraocular muscle movement. Ask the patient to follow your finger as you sweep through the 6 cardinal directions of gaze. Making a wide edge in the air, lead the patient gaze to the patient's extreme right, to the right and upward, down on the right, then without pausing, up to the extreme left, then upward. To detect horizontal, vertical or rotatory nystagmus, look for the jerking movements of eye as the patient moves. Look for left, then right, then up and down.
Now you just have to follow this pen as I bring it to the bridge of your nose.
Converging eyes normally follow the object to within 5 cm to 8 cm of the nose.
Okay, so now I'll examine your ear. Now I'll inspect your auricle and look for any deformity or skin lesion or lump.
To see the ear canal and drum, use an otoscope with the largest ear speculum that inserts easily into the canal. To straighten the ear canal, grasp the auricle firmly but gently and pull it upward, backward and slightly away from the head. Insert the speculum gently into the ear canal, directing it somewhat down and forward through the hairs if any. Be sure to examine the other ear in the same manner. To assess hearing, ask the patient,
Do you have any hearing loss or problem in hearing?
Yeah, little bit.
Okay.
If the patient reports hearing loss, proceed to the whispered voice test. Stand 2 feet behind the seated patient so that the patient cannot read your lips. Occlude the non-test ear with a finger and gently rub the tragus in a circular motion to prevent transfer of sound into the non-test ear. Exhale a full breath before whispering.
Now just repeat what I say.
3, U, 1, M, 4, U, 3, 1, L, C, 4, 3.
In normal response, the patient will repeat at least 3 correct out of possible 6 numbers and letters correctly. Repeat on the other side. For the patient failing whispered voice test, tuning fork test help to determine if the hearing loss is conductive or sensorineural in origin. In a quiet room, select the tuning fork of 512 Hz. Set the fork into light vibration by tapping it on your hand. Test for lateralization by performing Weber's test. Place the base of the lightly vibrating tuning fork firmly on the top of the patient's head or on the mid-forehead.
Did you hear sound on one or both the ears?
Both ear.
Okay.
Compare air and bone conduction by performing Rene test. Place the base of the lightly vibrating tuning fork on the mastoid bone behind the ear and level with the canal. When the patient can no longer hear the sound, quickly place the fork closer to the ear canal and ask if the patient hears a vibration. Here, the U of the fork should be placed forward, which maximizes sound transmission for the patient. So, in this way, eyes and ears are examined. Thank you.